Good afternoon. My name is Robert May, and I am the Executive Director at the Kensington Redondo Beach. Welcome to Whole Person Care. At the Kensington, we understand that caregiving for a loved one is a demanding responsibility. We celebrate the caregiver and recognize that making decisions about the care for your loved one is never easy. We are proud to partner with Providence TrinityCare and offer an Ask the Expert virtual discussion on whole person care to support you and your loved one on your caregiver journey. Each of the Kensington senior living communities offers a full spectrum of clinical support delivered by best-in-class professionals and carefully chosen partners provided amidst beautiful surroundings. The Kensington team is proud to offer care beyond what most other traditional assisted living communities can deliver. For example, high staff-to-resident ratios that exceed industry standards help deepen connections between caregivers and residents. Pocket programs, which are small group activities tailored to different interests and abilities, provide opportunities for friendship and greater engagement. Couples are welcome, even if the care needs of each individual are not the same. Complimentary meals for family and friends make dining together a special celebratory experience. After we are cleared from COVID, we invite everyone to come visit and dine with us. At Kensington Senior Living, we value our partners and work hard to collaborate to provide educational events in our communities. This joint effort to provide valuable content and to support our partners is critically important to us. Thank you for joining us today for our insightful discussions with Dr. Komatsu. Please join me in welcoming our moderator for today, Terri Warren, Chief of Hospice Palliative Care at Providence Home and Community Care. Thank you.
Thank you, Robert, for that warm welcome. And thank you so much for the opportunity to be with all of you today. What an honor it is on a gorgeous Thursday afternoon to spend time talking about something different than you may see in the news headlines of today. There are a lot of healthcare topics that dominate the healthcare news today, but we want to invite you into a conversation today to talk about something a little bit different, hopefully something a little more meaningful. What is whole person care? So, I am so grateful for the opportunity to partner with our colleagues at the Kensington and to be here today with my esteemed colleague, Dr. Glen Komatsu, to talk more in depth about this topic. So for those of you who haven't had the privilege of meeting Dr. Komatsu, he is a physician who began his practice as a neonatologist and worked for years as the medical director of neonatology at Little Company of Mary Hospital in Torrance, California. He during that time served as the chair of the bioethics committee, and then well into his career decided to take a change and enter a fellowship in 2004 after more than 20 years of practice as a neonatologist and go to Harvard Medical School to participate in a full-year fellowship in palliative medicine. Upon completion of that fellowship, he and his family returned to Southern California, and Dr. Komatsu since has served as the Director of Palliative Medicine within Little Company of Mary. He also serves as the Chief Medical Officer for Providence TrinityCare Hospice and Palliative Services in Southern California. And in addition to that, as if that's not enough to keep him busy, he also is the Medical Director for Trinity Kids Care. So it is my great honor to turn the presentation over to Dr. Komatsu. One note before I do, you may notice on your screen there is an opportunity to submit questions in the chat box on the right of your screen. If you have questions during the course of this presentation, we warmly welcome you to type your question into the Q&A box, And after Dr. Komatsu finishes his presentation, we together will go through the questions that have been posted. So with that, I turn over to Dr. Komatsu.
Good afternoon. Thank you so much for that warm introduction, Terri. It's a privilege actually to be presenting with Terri. I will say that while I get a lot of credit for this work, Terri Warren has been the driving force administratively behind creating the excellent palliative care and hospice programs that we have within Providence. And so it's always fun to be working with her again. As Terri mentioned, I have a few jobs within TrinityCare Hospice in Providence. And by way of introduction, I'd like to show you a couple of visuals. Next slide. Rather than talk about the work, I want to show you some photos. And these are photos of my patients, from babies, next slide, to children, next slide, to adults. I have the privilege of working with all of these age groups, and it is unbelievable work that I do every day. I feel very privileged and honored to do this work. Next slide. We have one of the most sophisticated healthcare systems in the world, if not the most sophisticated system. We have the best and the brightest minds working in medicine. We have state-of-the-art technology. We have wonderful hospitals all across the country. And yet, there are still these surveys that look at healthcare systems around the world, comparing our system to other developed countries, and these surveys find that we have the most expensive and the worst performing in terms of the countries with the most developed healthcare systems. A 2018 study showed that our country ranked 24th in the world in healthcare access and quality, despite spending the most money. And when you layer on top of that the worst pandemic in modern times, understandably, there may be many of you that are feeling a little bit shaky about getting good services in this day and age, despite all of our remarkable advances. Next slide. And when you couple that with a general sort of societal bias against talking about death and dying, about talking about our own mortality, it's a perfect storm for conflict and disagreement. So these are two of my favorite quotes that kind of reflect how society feels about death, how our society feels about death. I'm not afraid of death. I just don't want to be there when it happens. Next slide. And this is a second quote from Woody Allen. I don't want to achieve immortality through my work. I want to achieve immortality through not dying. I don't want to live on in the hearts of my countrymen. I want to live on in my apartment. Next slide. So what I would like to talk with you about today is that good care is still very much possible. And that's the paradigm I'd like to talk about, this notion of whole person care. And I'm going to explain exactly what I mean by that. But this kind of care requires an ongoing partnership between patients, families, and providers. This partnership means that you need to recognize your responsibility for your own health and well-being. We tend to think of health and well-being as the responsibility of our doctors, and really only 20% of that in some studies are related directly to healthcare. That 80% of our health and well-being is related to what are now being called the social determinants of health. Things like your income, your access to housing, your diet, exercise, the support that you have from your families or don't have from your families. Those are the things that really make a huge difference in the health and well-being of people. This partnership also means actively participating in your own care. Healthcare is not a passive process where you go to the doctor and the doctor just does things to you. We need your help to provide this kind of good care. So one example of that is talking about your wishes for how you would like to be cared for if you are so sick that you can't speak for yourself. Having the discussion with your loved ones or the person that's going to help you make decisions and speak to the doctors if you can't is critically important. And writing them down is even better. Next slide. This partnership also means accepting your reality and also accepting the fact that you cannot control everything about your health and your life. As much as we'd like to think so, it's just not possible. As a neonatologist, I would deal with women who had delivered babies that had problems, and they really struggled with the idea that they had a perfect pregnancy. They did everything that the doctor told them to do. They didn't drink coffee. They didn't drink alcohol. They didn't even take Tylenol. And yet they still had problems at the end. And the reason for that is the human body is not like a machine. And you cannot program a human body to do exactly what you want it to do. I think the paradox that captures this very eloquently and simply comes from Mark Lesser's book, Know Yourself, Forget Yourself, in which one of the central paradoxes that he talks about in life is fighting for change and still accepting what is. We have to be able to do both things at the same time and hold both of those concepts. And finally, this partnership means acknowledging our humanity and our mortality. You know, as good as medical science is, we still have not found a way to live forever. So all of us are going to die. That's part of our humanity. Next slide. So whole person care is a model that can help you get this kind of care if you're willing to form these partnerships with us as your providers. And I'm going to talk more about what I mean by whole person care through the use of some central concepts: the difference between curing and healing, the wounded healer metaphor, and finally, how palliative care is a new specialty of medicine that helps embody whole person care and helps whole person care happen. Next slide. When you're sick, when you're injured, you want to go to a doctor that knows, that's very knowledgeable, that's very skilled, and you want the disease eradicated, you want the injury fixed, and you want life to go back to normal. You don't want change. You want to look the same. You want to be able to do the same activities. You want to be able to go back to work or back to the activities that you normally do. Curing is always the first goal of medicine. The goal of curing is survival and the avoidance of change. And that's what we all want. No question. The problem is that there are so many things that we cannot cure in medicine. Even simple common conditions like high blood pressure, like diabetes, like asthma. We can manage those kinds of diseases. We can help people live a long time with them, but we can't cure them, correct? Next slide. And as I said, curing is really dependent on the skill and knowledge of your healthcare provider, whether it's a doctor or nurse practitioner. So you definitely want doctors or nurse practitioners that know what they're doing. Next slide. But when you have an illness that's chronic, serious, or even terminal that cannot be cured, then what? I would submit that there is a second possibility. And this possibility is called healing. We tend to use curing and healing interchangeably, right, as kind of the same term. But I would submit that healing is a very different process. Healing is a process by which a person actually comes to terms with their chronic, serious, or terminal illness. They actually redefine their sense of self. They develop a new identity, now an identity that is a person with diabetes or a person with heart disease. And still being able to recognize the possibilities for joy, meaning, and gratitude in their illness experience. And I know many of you, if not all of you, have seen examples of this in your own lives. You have seen people who are seriously ill or even terminally ill, who somehow seem to be very at peace with this process. They seem to be grateful and able to express gratitude for a life well lived. That is an amazing process to witness. Next slide. That is a process that you would call healing. So we as providers can help create the conditions where healing is possible. Like I can help, excuse me, relieve physical pain so that people can have more quality time with their families, with their loved ones, and do the activities that provide meaning for their lives. But only the individual with their family can make healing happen. This was very helpful for me when I was working in the hospital a lot in the intensive care unit, and I saw people having a really struggle with the end of life and wanting a lot of treatment that ultimately wasn't going to make a difference. And I felt like, oh, I just didn't have the right words. I didn't spend enough time with them. And what I've come to realize through this paradigm is that they just weren't ready to move towards healing. That healing was just not going to happen with that individual and their family. Next slide. This is an example of a family that's going through the healing process. Layla is a little 2-year-old girl on the right who had a neurologic condition that we couldn't even label, despite seeing a dozen pediatric neurologists across Los Angeles and Orange County. And the family made the very difficult decision to keep her at home and stop going to the hospital. And she passed away at 2 years of age. But this family is very much at peace with their decision, and in fact, have gone on to do things to try and create a legacy for Layla. And that's one of the things that we do at Trinity in the fall now is Layla's Walk, which you're going to hear a little bit more about during the closing comments. But this is an example of a family who's going through the healing process. Next slide. The second part of this paradigm called whole person care is the wounded healer. Now, the wounded healer is talked about a lot in Greek mythology, in Christianity, and other religious traditions. But I want to put it more simply, the fact that we usually think of patients as wounded and sick, and us as the caregivers being well and helping our patients in a sort of one-way relationship that we give to our patients and we give care to them and they take the care and hopefully get better. But the fact is that patients and families are wounded and can be healed in the way that I've just described. The second fact, which I'm trying to get across to my colleagues in healthcare, is that we are also wounded because we have either been sick ourselves, we've had friends or family members who have been sick or who have passed away, but we are also capable of being healed. So a better way to think about your relationship with your doctor is patients and families and doctors walking alongside each other as fellow wounded healers in a relationship that goes both ways, that we help each other and that we learn from each other. This is really a powerful, I think, paradigm and a way to think about our relationship with our patients. I think it's also a very powerful way to think about your relationship with your doctors, as your partner, not as somebody who you're dependent on, but somebody who also gets as much from this relationship as you do. Next slide. People ask me then all the time, okay, how do I find such a doctor? And that is the big question. Doctors are very busy. Doctors are on their computers, and it is not easy. So while every doctor should be providing whole person care, of course, not every doctor does provide whole person care. And so when we realized that in medicine, we did what we always do in medicine, which is when we see a gap in services, we invent a new specialty. So that's what we did. We invented a new specialty called palliative care. It became recognized as an official specialty of medicine in 2006. This is the field of medicine that I did my fellowship in 2004 in Boston. And it's a particular way of looking at care and treatment and patients and families. This is a definition that was vetted with the public by the Center for Advancement of Palliative Care. That organization has done so much to advance palliative care in this country. And one of the things they realized was very important is the public needed to understand our specialty. And so we needed to come up with a definition that would be understandable to the layperson and also not too scary, because palliative care is frequently conflated with hospice. And while there is definite overlap, hospice is palliative care in the last 6 months of life, whereas palliative care can be provided at any stage in the person's illness, from the time of diagnosis till the very end. So this is the definition that CAPC came up with. A specialized medical care for people with serious illness, focusing on providing relief from the symptoms and stress of a serious illness. Notice that it talks about symptoms and stress. The goal is to provide quality of life for both the patient and the patient's family. It's not just the patient. Next slide. Palliative care is provided by a team. So it's not just doctors. Nurses, social workers, chaplains, in some cases pharmacists, dietitians, respiratory therapists, all of us working together with your other doctors. So this is palliative care. It does not replace your regular doctors, your subspecialists, your primary care doctor, and all together we will try to provide an extra layer of support. It is appropriate at any age and at any stage in a serious illness and can be provided alongside curative treatment. That's kind of a long definition, but I think it covers all the major points. Can you go back one slide, Katie? Just want to go over the definition one more time. So, relief from symptoms and stress of a serious illness does not have to be a terminal illness, and improving quality of life for both patient and family. So much of medicine is focused on cure, as I just mentioned, and not enough medicine is focused on quality of life. And this is what we are focused on in palliative care. Next slide. It's a team sport, and we provide, along with your doctors, an extra layer of support. And it can be done at any age or any stage. It does not mean you have to give up any other treatment. So as you can see, I provide palliative care for babies, children, and adults. Next slide. I want to say just a few words about suffering. Suffering is one of the things that is so difficult for us in healthcare to address. And not to mention how hard it is for patients and their families. And this simple equation, I think, sheds a lot of light on the notion of suffering, on the concept of suffering. It's taken from Frank Ostaseski's book, The 5 Invitations, which is a book I highly recommend, about what death can teach us about living. And Frank talks about pain as being part of our humanity, right? Everybody goes through pain, whether it's physical pain, emotional pain, spiritual pain, existential pain. Pain is unavoidable. But what we have some control over is the second part of this equation, resistance. The resistance to the pain is directly proportional to the amount of suffering. The people in the greatest denial, and I see this in patients, say, with cancer, they don't believe that they have cancer, they don't want to believe that they're dying or that the cancer is not curable. And the more they resist, the greater the suffering. This is understandably what we see in children who are terminally ill. The parents just have an understandably difficult time accepting the reality of their child's medical condition. But when you can let go of this resistance, that's when the suffering gets less. And not only the suffering for the patient, but the suffering for the family and the suffering of the caregivers. That's what people who are going through healing have been able to do. They've been able to lower the amount of resistance they have to the pain of their terminal illness. It still hurts. It's still very sad. I'm not saying that we can get rid of all of that. But what I am saying is that if we come to terms with our humanity and our mortality, this can be a more comfortable process and a healing process whereby we can find meaning and joy amidst the pain and suffering of the last chapter of our life. Next slide. So in closing, I'd like to go back to my pediatric roots. And yeah, I think children have some of the most profound things to say, and they are wise beyond their years, certainly. Don't cry because it's over, smile because it happened. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not. These are quotes from Dr. Seuss, obviously, and I think these capture whole person care so well. Next slide. Thank you very much for your attention. I wanted to leave plenty of time for questions and discussion. I'll turn it back over to Terri.
Thank you so much, Glenn, for that wonderful presentation. And honestly, what I think is a different framework, a different way for us to think about what healthcare could be and what some options are for each of us, for our spouses and partners, our parents and grandparents, our neighbors, our friends, and even our children. So I'd like to invite all of you who are participating in this webinar now, if you have any questions, please feel free to place them in the Q&A section and we'll work through addressing them.
Good afternoon.
So Dr. Komatsu, one of the first questions is probably one of the most challenging ones to answer, but it may be on the minds of several of us who are on this call today. If I want to find a provider, if I want to find a care team to care for me or for someone I love, who are more whole person care oriented, what kind of questions do you think I should ask?
That's a really good question, Terri, without an easy answer. It's a very simple question, but not an easy answer. There's a couple parts to that question. You, of course, want doctors and nurse practitioners who will listen to you, who will get to know you as a person, as a unique human being with your individual needs. But you want to be able to speak up and not be afraid to tell them what makes you unique. What makes you unique, I'm sorry. You know, what is important to you? What gives your life meaning? And doctors may not ask those questions, but you need to tell them. Then if you're in the hospital or other setting and you become seriously ill, there are palliative care teams available now in almost every hospital, in almost every health system, whether you're in the county system, whether you're in Kaiser, whether you're in the VA or in private hospitals. Almost every, I think 95% of hospitals now have palliative care programs. It doesn't mean that all palliative care programs are created equal, but it means there's a resource to help bridge some of these gaps between you and your doctor team.
So if most hospitals now have palliative care teams in place, is this something that just comes with your care when you're in a hospital, or is it something you need to ask for?
It depends on the system in the hospital, but generally you have to ask for palliative care. And your doctor in charge of, excuse me, the doctor in charge of your care in the hospital has to order a palliative care consultation.
Okay. One question in the chat says, how do I get my doctor to join a palliative care team and partner successfully?
So good question. Doctors don't join the palliative care team. They work together with the palliative care team. Those of us that are doing palliative care, most of us have had special training. As I mentioned, I spent a year in Boston studying this field, which is very, very different than any other kind of medicine I'd ever practiced before. Learning the skills, the communication skills, the skills about managing pain and nausea and constipation and anxiety and depression, the skills in symptom management, and also learning how to work with a team of nurses, social workers, chaplains to provide this whole person care.
Mm-hmm. Thank you. There's a comment in the chat that is also referring to a PACE program. And it states that, I think that is why PACE programs such as Providence Elder Place are so helpful. So that is such a wonderful comment to bring into this conversation today, because whole person care and elements of whole person care can manifest and come to life in certainly within palliative care, but also in other forms of healthcare and other benefit structures in healthcare. PACE programs exist in many parts of the country, and they are all-inclusive programs for elderly people who provide a team approach, also a center for care, and a very specific holistic model of care as well. Dr. Komatsu, do you want to add anything?
Absolutely, that is right on target, Terri. Every doctor that takes care of patients who are sick does palliative care, and there are many programs that embody palliative care, like the PACE program. If you have a really high-functioning assisted living facility, skilled nursing facility, board and care, the best places who provide the best care really embody the tenets of whole person care that I described. So it's not the purview only of palliative care subspecialists. It's a responsibility of every healthcare provider, really, in every discipline, to try and provide whole person care.
Mm-hmm. Thank you. So here's a little bit of a different focus for a question. Can you provide some tips for reducing resistance?
That's a really good question. I think about this question a lot, and it really depends on the person and kind of what things are important to you, what things give life meaning, give your life meaning. So for some people, it may be being in nature. So reducing resistance may mean spending more time in nature, allowing nature to be a healing force in your life. It may, for some people, it's their religion. For some people, it's their families and children. And so lowering resistance may be spending more time and going more deeply into your religious beliefs and talking with your religious leaders and clergy. So just spending time with your family may really lower your resistance as well. But a lot of this is about your perspective. It's about you deciding, you know, I'm not going to fight so hard against this.
Mm-hmm.
I'm just going to realize I realize that this is my life. The people that can't accept their life, that's where the resistance is.
Mm-hmm.
And so if you can ease into and accept who you are, you know, which is so hard. It's easy for me to say, it's so hard to do. You know, it's not just for me personally, it's not easy for me to accept this older version of myself. I like the younger version that I could do more things physically and be more active and be more athletic. But, you know, that's not who I am anymore.
Right.
So it's not easy, but for each person, it's a very individual and unique process.
Mm-hmm. Absolutely. How do you think music can play a role in the healing?
The arts are incredibly healing, and they always have been. That's why they play such an important role in pretty much every culture in the world. Whether it's art, whether it's music, whether it's literature, all of those things are incredibly comforting and insightful. They offer us insights into our human experience. And in those ways are very supportive and healing.
Yeah, thank you. Thank you. So, when do you think it is the quote unquote right time to look into palliative care?
That's another really good question. I think it's when you're not feeling well. I like to talk about the notion of dis-ease. Instead of disease as an entity, it's dis-ease. You don't feel comfortable and you don't quite know what it is. You have a serious illness and you're not having physical pain necessarily, but you're just not comfortable. And you would like to talk to somebody about it. You're not sure exactly what direction to go. Those are the times when you're at these crossroads where palliative care can be very helpful. And you know, if we can't be helpful, we'll tell you that too. But it's always, as my good friend and colleague Ira Byock likes to say in palliative care, it's always too soon until it's too late.
Painfully true. Painfully true. So, how does Medicare work with palliative care?
Not great is the short answer. So one of the reasons why, for instance, outpatient palliative care services are not very plentiful and very available is because the lack of Medicare funding for that kind of program. So we are lobbying intensely in Washington for that to be a covered benefit. Terri does a lot of this work herself, advocacy work, going to Washington, D.C., talking to our legislators. But there are so many people clamoring for so many things these days in healthcare, and palliative care is just one of those things.
Mm-hmm. Yes, there is no question. The financing of healthcare is a complex arena. So a very specific question in the chat is around, can you suggest a few other reading resources on the subject of healing and or whole person care?
Great question. I think Ira's last book, The Best Care Possible, Ira Byock, B-Y-O-C-K, is a really good book, and it's designed for not just people in healthcare, but for the public as well. And he talks about his vision of what the best care possible would look like, using palliative care principles throughout healthcare. And that is a sort of a platform that Ira came to Providence with, and why we partner with him now in working exactly on that, spreading palliative care principles throughout the healthcare system.
Great, thank you. And during the course of your presentation, you also mentioned a specific book by Frank Osteski?
Yep, Frank Osteski. It's called The 5 Invitations.
Great.
Frank Osteski. It's kind of a difficult name to spell. It is Ostaseski. Osteseski. So, but if you Google The 5 Invitations, I think it should pop up. He was the person that started the first Zen hospice in this country in San Francisco during the height of the AIDS epidemic. And he is a very wise soul who has spent his life dedicated to the care of the sick and the dying. And a lifetime of lessons learned is incorporated into that book. I use that book as a teaching tool for all my colleagues.
Mm-hmm. That's great, thank you. So for our last question, this is a creative one. What advice would you give to Woody Allen? That's a great question.
That's a great question. That man has issues, obviously. I think, last I heard, he's still in psychoanalysis. I mean, he is definitely a work in progress. So I think I could not give him any advice that his psychoanalyst could not give him in a more, I think, real fashion.
Great, thank you. So I just want to thank everyone for their time this afternoon, particularly Dr. Komatsu for leading all of us through a conversation, and really what I hope for all of us becomes the beginning of an ongoing thought process about our own care. We talk a lot about the science of medicine, right? And that's what we normally associate with medicine is science. Appropriately, it's a really important part of care. But our conversation today ventured more into what I would consider that next step, the art of medicine. Maybe even the heart of medicine. While science alone is incredibly important, it's not going to make you feel safe at night. And it's not going to make you feel loved and cared for. But the kind of whole person care and the elements that provides by a whole team in an array of care settings, I hope serves as food for thought for all of us. So I would like to thank you all for attending today's webinar. Please enjoy this closing video from our great partners at the Kensington.
Good afternoon. My name is Cece DeGraff, and I am the Executive Director of the Kensington Sierra Madre. We hope you enjoyed the Ask the Expert whole person care presentation as much as we did. The family at the Kensington values the relationships we have with our community partners, as we value the relationship we have with Providence TrinityCare, as they share the same respect for their patients as we share with our residents and families. The Kensington promise is to love and care for your family as we do our own, and we take great pride in our relationships and sponsoring educational events with our partners. I am proud to present the Trinity Providence team with a donation in the amount of $2,500 to be directed to the Trinity Kids Care Program. Trinity Kids is the only hospice and palliative care program dedicated to the children in LA and Orange counties and offers compassionate care to over 300 children yearly. Their annual fundraiser, Layla's Page Nature Walk, is just around the corner on Saturday, October 10th. Please join the Kensington team in supporting this ever so important event. For more information, please visit their website, providence.org. Thank you again for joining us today, and we hope to see you soon at the Kensington community.